Hello everyone, I'm Marvin Polis. I'm the Editor-in-Chief of Alberta Doctors Digest for the Alberta Medical Association, and with me is Bobbi Jr. Bobbi is a blogger and an author, and she writes about aging, which is really quite fitting because the latest edition of Alberta Doctors Digest is actually a special edition about aging in Alberta, and we're here at a nursing home, and we're sitting outside on this beautiful outdoor patio with the crows and the magpies. I hope you don't find them too distracting. They're kind of fun, actually. So we're going to talk about the issue, and Bobbi actually wrote one of the feature articles, and that's what we're here to talk about. We're here to talk about caregiver burnout. And I happen to have the article here in front of me. Of course, the publication is available on ebook as well, and perhaps we'll refer to this. But Bobbi, first of all, I wanted to ask you, really, how do you define a caregiver? A
caregiver is anybody either living with their recipient or showing up on a regular basis to help them out.
What is the issue with burnout?
The main problem is that care needs gradually increase. When from the caregiver's perspective, there's a little bit more today, a little bit more tomorrow, and gradually they get to the point where they can't carry on with what they've been doing.
Now, in the article, you actually speak of a fictionalized couple.
Yes.
I guess it's really a composite of some experiences that you know of and some people in your network have known of. Tell me about this story.
A woman was caring for her husband, but gradually the needs increased. She was getting up at night more and more often. She couldn't go out during the day unless she had extra care for him. But gradually a point came where she had no options anymore. All she did from morning to night and through the night was to care for her husband.
So I guess her life was no longer her own anymore.
Absolutely.
And she was exhausted, I guess. And what were the consequences of this? I mean, she was considering some very extreme measures,
She
right?
was. When you're that exhausted, and again, the exhaustion comes gradually as well. So you don't remember what normal was like. It's been so long. And she got to a point where she knew she couldn't do what she was doing any longer. She loved her husband desperately, and she was not going to let go of him or leave him in a terrible situation. So in her mind, the only thing she could do was remove herself. That way somebody else would come in and take charge.
So I guess she was thinking,
She was going to kill herself.
She was going to kill herself. And that is very, very drastic, of course. And I guess her rationale was that if I kill myself, then my husband will accept coming into a nursing home. I mean, we're here shooting at a nursing home today.
They'll find somebody who can do the job properly because she couldn't anymore.
So what was the solution to this? I mean, she had this discussion with her husband's doctor, right?
Yes, and that was very lucky because the doctor very wisely separated them and spoke to her privately, and she was able to say that that was all she could find. And she did say, unless you've got something better.
So there was really some astuteness on the case of the doctor here to pull her aside and have this conversation, because he recognized that there was something going on here.
Yes.
Okay.
Yes. He asked her how she was doing and if there was anything that could help. And in her mind, nothing could help. And finally, as he asked a little bit more, she said, well, I have to die. I have to kill myself, and then you'll take care of him better.
Okay, so obviously the doctor did the right thing, intervened, and what actually happened?
It was simple on his part. He simply called a geriatric social worker, and he was with a PCN. The social worker, the geriatric nurse came in, and they brought in the supports, and within a few weeks things had changed so drastically that she now was able to think clearly.
Fantastic. So how did the story end?
He was at home for about another 3 years, and then his health really went down quickly, and they did move him to a nursing home, and the last few weeks he had palliative care. And in the end, she really felt that she had cared for her husband right to the end, which is what she wanted to do.
That's really a good story. Now, what do you think is the message here for doctors in Alberta?
Not to ignore that the caregiver and the recipient, well, they're together. They have to be dealt with together as a unit. And if there's adult children involved too, they have to be brought in, because without the caregivers, our system's hooped. We know this. We have to have our caregivers, and they have to be strong. Alberta's got incredible supports. They've got a really good home care system, I believe. If caregivers can access that appropriately, we can keep people at home longer.
I think something that we've heard through this story, that there's really a role for the doctors in connecting the families with the caregivers and to recognize that this stress is going on.
Yeah, and it's simply a question each time you see the couple. If each time you ask honestly and say, how is the caregiver doing today?
It's not just about the symptoms of the patient.
That's right. That's right. If we want to support the patient, we have to support the caregiver too.
Great. Thank you for joining us.
Thank you.